Hi, I'm Dr. Sarah Walley, and I'm here today on behalf of the Animal Companions of Las Cruces to talk to you guys about infectious diseases and vaccines. Here in southern New Mexico, we see a lot of very severe viral infections that can actually result in the death of a lot of pets in our area. These are primarily parvovirus and distemper virus. Vaccines are our most important tool at combating these infections. If a puppy's mom was vaccinated or had previous exposure to these infections, she'll pass on antibodies that will protect the puppies for the first 6 to 12 weeks. In addition to protecting these puppies, however, they also affect the way that our vaccines work. The immunity that they get from mom wears off between 6 and 12 weeks, and so we start vaccinating them between 6 and 8 weeks of age and booster every 3 weeks until they're 16 weeks old so that we can make sure that they get at least 2 effective vaccines in. Vaccines are extremely effective at preventing these infections. Majority of the cases that we see are in dogs that are not vaccinated, have not appropriately been vaccinated, or have been vaccinated using less effective vaccines that can be purchased at the feed store. In order to give your puppy the best chance of having a normal and healthy life, we recommend that you consult with your veterinarian to make sure that they've been appropriately vaccinated. Parvovirus is a very hardy virus that could live in the environment for years. It can be spread from area to area on shoes, by birds, by flies, and lots of other ways. If a puppy gets sick with parvo, we'll typically see a loss of appetite, vomiting, and diarrhea. There's no specific treatment for parvovirus, and instead we focus on preventing or treating dehydration with fluids, addressing the vomiting with anti-nausea medication, and getting them on antibiotics as they're very prone to secondary bacterial infections that can be severe and cause sepsis. Without treatment, about 50% of infected puppies will die. Even with treatment, close to 30% will not survive the infection. Also remember that everywhere that puppy has been is now contaminated with the virus, and that virus will live for many years. Distemper virus is not a hardy virus. It does not live long outside of the body. But if an unvaccinated puppy has contact with an infected animal, they have a very high chance of getting sick. Symptoms typically start as mild GI signs, a little bit of vomiting and diarrhea, but then progress to respiratory signs like coughing, runny nose, runny eyes, and difficulty breathing. These symptoms can vary from mild to very serious. In fact, about 50% of dogs will die from the respiratory symptoms. Like parvo, there's no specific treatment, and again, we're focusing on making sure they stay hydrated, trying to keep their fever under control, and treating secondary bacterial infections, which are very common. Of the 50% of dogs who survive distemper, about half will go on to develop neurologic signs several weeks later. Sometimes these neurologic signs are very mild and just include some tremors, but they can be very serious, including very serious and severe seizures. Oftentimes, they're so severe that we have to euthanize the dog. Thank you so much for watching. For more information, please visit animalcompanionsoflascruces.org.